Hi, this is Chris from Fitness Man's Answers. This is Sunday, and this week's topic is kind of whatever you want to talk about. I'm going to be talking about over-the-counter pain medicines. What do you do when you get an injury? So many of us just, open up the cabinet, glare at all the medicines that we have, and we wonder what is going to take away our pain. I have gone through and done some research, and also I've gone through and found some helpful information that will guide you as you have your next injury, as you have your next pain, as you have your next experience needing over-the-counter pain medicines. So I hope you have a fantastic week, and I'll talk with you next week. Bye. As a middle-aged athlete trying to overcome injuries that are from overusage of muscles and just the fact that middle-aged things aren't as strong as they once were, I thought I would compose a little bit about OTCs, or over-the-counter medications. It's so easy when you have a pain and you say to yourself, well, this worked before, but really to be knowledgeable and to know what works and what's inside each ingredient makes you a better consumer. How many of us have many different pain relievers lying around our house because at one time it actually worked? Okay, I'm going to talk about most painkillers fall into two classes: N-acetylphen or non-steroidal anti-inflammatory drugs. The acronym is NSAIDs. Experts say that generic forms are just as valuable as name brands. I personally have not seen that. I think that personally name brands are better, but if you check the ingredients, my friend who's a pharmacist also agrees, and you can really see what's in each brand. Of course, the generics are always cheaper. First of all, you want to realize that sometimes there's food or drug interactions. If you're taking another type of medicine, you want to make sure that you can safely take that over-the-counter medicine. Doctors are not always able to communicate with each other in knowing who gives what medicine, and there can be interactions. Also, too, there's different types of kinds of NSAID or N-acetylphen. One is the most inexpensive, or a tablet that's formulated with a binding agent. There's a capsule, which is a gelatin container that holds a powerful medication. A caplet, smooth coating that goes down nicely. A gel cap, or a gel coating, a gel tab. Also, we have liquid gel that is pretty fast. There's buffered tablets. Those are good if you have a stomach irritation. And also, too, there's topical agents, not necessarily over-the-counter NSAIDs or N-acetylphens, but things like Biofreeze that really work well on the pain. I personally use Icy Hot, Icy Cold, Aspercreme, Bengay, Biofreeze. Some products are a combination of medicines that have caffeine in them to lessen pain, and some contain antihistamine or things that make you sleepy, and PM varieties. Decongestants help with decongestion or cough, and sodium bicarbonate helps neutralize stomach acids. N-acetylphen brand names are Tylenol, Panadol, are pain relievers on the brain and mask pain. They mask pain. That's something to think about. The pain's still there, they're just masking it. They reduce pain and fever, but not inflammation. That's an important point. If you are an athlete and you're dealing with inflammation, you want to take a ibuprofen or something like that. Naproxen, aspirin, ibuprofen are non-steroid anti-inflammatory drugs. These drugs reduce swelling, treat muscular problems. They don't treat pain. They treat muscular problems such as arthritis, tendonitis, bursitis, gout, dental pain, headache. They do with headache, but not so much for pain, migraines, or symptoms associated with the monthly period. Aspirin is a pain reliever. It's suggested that children don't take it, but it can be used effectively to treat heart attacks or to prevent them, prevent strokes, treat arthritis and inflammation. Recommended doses are 325 to 650 milligrams every 4 to 6 hours. That's really important because you want to look at the bottle because different bottles have different strengths. Maximum strength, you might not have to take 2 or 3. And also there's the point about your weight, your dosage, how you tolerate different medicines. Always should be done under a doctor's care. Some kinds of pain relievers contain more than one type of medicine. If pain lasts more than 10 days, it's recommended that you go back to the doctor and see if you can find something else to alleviate your pain. So I hope that this little discussion was helpful, and I'll talk with you next time. Bye.